Now, a worrying statistic. As many as 22,000 people in the United Kingdom may not know that they are carrying the HIV virus. Late diagnosis makes the condition harder to manage and increases the risk of it being passed on. That's what this week's National HIV Testing Week aims to address. Our health and social care correspondent Victoria MacDonald has been to one NHS trust where they are attempting the biggest ever testing campaign. Every single person going to the outpatients clinic will be asked if they want to know, are they positive or negative?
I don't know if I have HIV or not.
I know
if I have HIV or not.
It is the hidden face of the epidemic. The number of people with HIV who are infected and do not know it. The latest estimates believe it could be as many as 22,000 people in the UK.
So I'm Vanessa and I'm one of the consultants here, and so what we're just trying to do is encourage everyone to have a HIV test because it's National HIV Testing Week.
And as part of HIV Testing Week, Bart's Health Trust is holding the biggest ever hospital-based HIV testing campaign. Across their 6 sites in East London and all their outpatient clinics, they're aiming to make it as normal as having any other blood test.
This is the first time a hospital trust in the UK has tried this, asking everybody who comes through outpatients over the next week if they will have a test. And they're doing it for one very simple reason. All the figures show that 1/5 of people who are HIV positive don't actually know it.
The HIV rates in this part of London are 3 times higher than the national average, and the numbers of HIV-infected women and children are also significantly higher.
It costs about £5 to do a test. It costs £5,000 to keep someone alive with HIV on treatment for a year. But the cost of missing a diagnosis and for someone getting very, very sick can be £500,000.
And by midday, in just this one outpatient clinic, 57 out of 75 patients had been given a sticker. They'd agreed to be tested.
Why have you agreed to do this?
I was a regular blood donor in my country. I have donated blood several times, maybe 30 to 35 to 40 times. So I'm thinking, let me have a taste.
So I'm just going to prick.
And there to see the campaign and be tested was David Furnish, civil partner of Sir Elton John.
Why do you get tested every year?
I think symbolically, I think if I'm going to talk the talk, I need to walk the walk. Even though I'm in a committed relationship, I want it to be part of my routine testing, the same way I get all my other blood parameters tested. I feel symbolically, as chairman of the Elton John AIDS Foundation, it's something that I should do.
The idea is no news is good news. Patients will only be told if they are positive, and that takes about a week. In this case, Mr. Furnish had the advantage of the instant test, and the result, 1 dot, no HIV.